Hi, welcome to another episode of HPA Global Insights. I'm joined today by my good friend Ian Chant. He is the general manager of Aker BioMarine in Australia. Ian, how you doing?
Great, Jeff. Fantastic. You're looking well. Haven't seen you for a long time.
Yeah, it's been quite a while. Today we're going to talk about all about krill oil and Australia and Aker BioMarine and all these other great things. But first, let's for the people that aren't blessed enough to know you or have met you, can you just give us a little bit of background on yourself?
Yes. I've been in the industry for about 25 years, in both OTC, pharma, and complementary medicines. Worked for a number of companies. Currently with Aker BioMarine, but have spent time at an industry level on the board of Complementary Medicines Australia for 9 years, and the immediate past president of Complementary Medicines Australia. So I know the industry down here fairly well.
Let's learn a little bit about like Aker BioMarine for the people that don't know who Aker is and what is Aker BioMarine or who.
Uh, Jeff from Aker BioMarine is a biotech company based or headquartered in Oslo, Norway. Um, it's all about harvesting krill, probably the largest biomass on the planet. It harvests it sustainably, and uses that krill, which krill, by the way, is this little like shrimp-like thing about the size of a paperclip. Uh, they harvest it and use it predominantly for aquaculture, but quite a large amount of it is extracted or has the lipid fraction of it extracted and various products made from it. That extraction, by the way, is done in Houston, Texas. And from there, it's distributed throughout the whole world.
Primarily, it's an alternative source for omega-3s.
Correct. We tend to sort of put it in the omega-3 space, but it's more than that. It has choline, it has astaxanthin, the fatty acids, the DHA and the EPA are sitting on as a phospholipid, which is very different to the most omega-3s on the market. So as a consequence of that, it has different benefits, if I can put it that way.
So it's a product that's extracted out and it's kept kind of in its natural state with the other constituents that help it do its job.
It's a virgin oil, if I can put it that way.
All right, and so I mean, the big thing for this video here is just the news that came out about Aker's krill oil in the Australian market. The Australian government has taken notice, and you've gotten some approvals namely through the TGA, correct?
Jeff, that's correct. And it's, for my time in the industry, 25 years, this is really exciting times. In Australia, we see these products as medicines rather than as supplements. So they're regulated as such. And so the claims that you can make are somewhat limited, and they're prescriptive, if I can put it that way, or permitted. So there's a limit to what you can actually say. There's a new pathway that came about in 2018 that allowed for higher level claims, and that's called the assessed listed pathway. And we worked in conjunction with Swisse and Australia's National Science Agency, the CSIRO, to do the research to substantiate higher level claims for krill in the treatment of pain associated with osteoarthritis.
So that's amazing stuff. So what does that mean for? You mentioned you did this with Swisse, which is one of the top brands in Australia, in Asia, and around the world. What does this do for them to get this approval?
So I guess when you look at the original objectives that the regulator and the industry put together for this pathway, it was about firstly encouraging research. And often in our industry, when you do research, you go and make a claim out there, but it's not too long before you have people passing off or using that research once it's in the public arena. So what this does is protects the research and allows higher level claims, and they're protected for a period of time. You get an exclusivity period, can be up as much as 5 years in terms of making those high level claims. So encouraging research was the first objective of it. The second thing is to strengthen the trust relationship between the industry, between the brands and consumers. And by having effectively of these products on the label can have a logo that says TGA assessed, and that communicates to the consumer that the product has had its efficacy assessed by our regulator. Probably somewhat different to the FDA, where the claims are, it hasn't been investigated by the FDA.
Very different. Yeah, very different.
Here we've got a regulator that's prepared to say, yes, we've assessed this, and here's our logo to say that we've done it.
Yeah, that's very different. Definitely. So that's on the label itself. What is the exact claim, or what does it say on the label?
Definitive claims. And sometimes those definitive claims are just simply the removal of words. So the claims that can be made are relieves pain associated with mild to moderate osteoarthritis. So relieves pain, not may, not supports, relieves pain, simply that. Reduces stiffness and improves flexibility. So all of those qualifying words are removed, and it's very definitive. The other, by the way, you can still add all of the normal listable claims associated with cardiovascular health, eye health, etc. But the actual high level or claim is the one that's actually has its efficacy reviewed.
So yeah, let me just jump in there quick. So for example, with this claim, it removes may, and it's kind of giving that definitive message to the consumer that this product will help you with, your knee pain or your, osteoarthritis. But the other claims are still, they're kind of like the structure function claims the US uses. So it would probably say something like supports cardiovascular health or something like that.
Yeah, exactly.
Okay, that was my next question, was going to be like, why? I know Superba Krill and Aker is put a lot of money and time and effort into studying various health functions with krill, and I was just going to ask, like, why did you go after the kind of osteoarthritis claim and not the cardio or cognitive or some other type of claims? But seeing that you can keep all those on the bottle, you just have to put some of those may or support words in front of it. I think it's suitable.
So Aker's done about 50 human clinical trials, 50 plus human clinical trials, probably over 130 clinical trials, and obviously some on animal studies. The reason why we pursued osteoarthritis is when krill was first introduced into Australia, it was introduced as an osteoarthritis product. The claims that were originally made, probably back in 2010, were eventually disallowed by the regulator. And so this is about getting it back to where it should have been in the first place. And it took us a long time to do it, because when you're doing research, we did it with 235 patients across 3 hospital sites. Just recruiting them takes a lot of time.
How long did this take?
We really started in 2016,
wow.
And we finished. And the actual work was published in the American Journal of Clinical Nutrition in July last year, 2022, and it took us over a year to put all the evidence package together and work with the regulator to get the claims. So it's in Australia, an OSL, just a listed medicines, a notification, it takes you 2 weeks to get that. This was a year, so it's a fairly significant commitment.
Wow. Yeah, that's a lot of work. And we were talking earlier, just to clarify. So this may be protected from anywhere from 2 to 5 years for Swisse as a finished product. So another company, if they wanted to use that same claim, they would have to jump through all those same hoops, and it would take them probably to the 5-year limit before they even got approved to use it, I would assume.
Exactly. So another sponsor would have to go and present some new research or wait until that time expires. So and it's not an easy pathway to actually, not yet. I think the regulator's still learning about this pathway. So we were we're only the third assessed listed medicine to be approved in Australia. So it's very new. But it's exciting in some respects because for our industry, it's about developing that trust relationship with consumers, and consumers can believe the product does what it says it does, and that's great, I think, for the industry.
And correct me if I'm wrong, but I think the Australian market for supplements, I think a lot of it is really projected out of the pharmacy channel, right?
Yeah, I think probably 70-odd% of the complementary medicines are sold through pharmacy. The channels are pharmacy, some grocery, bit of healthcare practitioner. We don't have much MLM down here. So yeah, it's very much a pharmacy based industry, and an industry where advice is important. So consumers go along and seek advice from their local pharmacist, who is a trusted professional in Australia. Probably one of the highest up there. So trusted, in fact, that politicians pay attention to them.
Well, that's what I was getting at, was like, the sales channel is already kind of a trusted channel in Australia, people buying from pharmacists and asking pharmacists for recommendations. And now they have a krill oil product from Swisse that's got an approval from the government right on it. That's really amazing. So with that in mind, does that do anything for Swisse or Aker in general when you look outside the borders of Australia? Having this TGA approval, is it going to be beneficial?
I think absolutely. Firstly, the opportunity exists in terms of exploiting mutual recognition agreements. So there are mutual recognitions agreements between different regulators. So something that has its efficacy assessed by the TGA might be able to be easily accepted by another regulator. So it works well in that area. I think Swisse has, through H&H, it's a subsidiary of H&H. It has a significant presence in the Asia Pacific area. I believe that you'll start seeing the product in the Asia Pacific area within the next year or so.
Yeah, that's good. I mean, just working in Asia and particularly China for many years, TGA is always for manufacturing facilities, getting TGA approval and getting TGA approval for anything is kind of like a gold standard and an amazing thing to get in the industry. So that's kudos to you and the entire Aker team. You brought up Asia Pacific, and of course that's China's my backyard, and I know the Aker team in China and the Swisse team, a bunch of hardworking, awesome group of people. China has a new system in place for health approvals for new claims, and I'm sure they're probably looking at that. This approval from TGA, I think, would be wonderful piece to use to justify and give the Chinese government something to look at, and get an approval similar to that, a health claim in China as well.
Yeah, when you look at China and you look at krill in China, it's just starting to grow. It's in its infancy compared with the US. The US it's quite mature, and it's like a cracker ready to go off. And this Ostel A has just shortened the wick. It's about to go big time, and so my prediction is China is going to go very big in terms of krill oil in the next, certainly within the next 5 years. So it's a place to be.
That's awesome. Well, Ian, thank you so much for your time. and enjoy your up and coming summer as you approach it. I know you guys will be down there surfing. You have the surfing Santa Claus and all that. And while the Northern Hemisphere is, blanketed in snow, I mean, Texas, not so much, but great to see you.
Yeah, thanks so much, Jeff. And we'll catch up again next time I'm stateside.
Okay, sounds great. All right, Ian, thanks again. And for those watching, if you have any questions, please feel free to email me, and I'll have a card at the end for Ian's information if you'd like to contact Ian if you have any questions. And that's it. So thanks for joining us, and we'll see you next time. Thank you for tuning in to HPA Global Insights. Please like, subscribe, and share with your colleagues. Any questions or suggestions, email us at info@uschinahpa.org. This channel is operated by US-China Health Products Association, which is a nonprofit organization. Please consider joining the association and supporting its global endeavors. Your support is very much appreciated. Until next time, take care.